to be able to send. We've just started recording this webinar and we are about to get started here today. Thanks so much, everybody, for joining us. I am Bobby Miloro of Miloro Law, and I'm here today with Denise Brown, also of Miloro Law, and a special guest who I will introduce in a moment. And we are kicking off Medicare open enrollment season. It's October 1st. As you all know, Medicare open enrollment begins on October 15th in just a couple of weeks. So we wanted you all to be well informed and well armed and ready to be able to make educated and informed decisions as you embark on your Medicare open enrollment. So at Miloro Law, our firm is an estate planning and elder law firm. We help adults of all ages get their ducks in a row and their legal affairs in order with proper estate planning. And we also help seniors who are 65 and over qualify for and obtain government benefits to help them cover the cost of their long-term care needs as they age, and we'll discuss that a little bit later. The goal of the webinar today is to help you better understand your Medicaid options as open enrollment begins. Whether you're new to Medicare or wondering if your existing plan is still right for you, this event is designed to provide you with the knowledge you need to make informed choices. The key topics we will cover today are an overview of Medicare Parts A, B, C, and D, kind of an alphabet soup of Medicare, understanding the differences between original Medicare and Medicare Advantage plans, which are like an HMO, tips on choosing the right plan for your needs, and then an overview of the Medicaid Long Term Care program, which picks up where Medicare leaves off and helps seniors pay for their home health aid, assisted living, or nursing home. If you do have a question throughout the presentation, we have reserved time at the end to address all of those. You should see on your toolbar on the bottom of your screen a chat feature. If you just pop open that chat and type your questions there, we will get to those at the end of the program. We will also provide you with our contact information where you can reach out with specific questions if you don't want to share them. But please use the chat, direct your questions to Denise Brown. Denise is going to field those and organize those for us, and that will, I think, work best. And so we have a lot to cover, so let's get started. As our special guest today, we have Kareem Grant. With over 10 years of experience as a Medicare insurance agent, Kareem spent a decade working with Humana before starting his own agency, My360 Health, nearly 2 years ago, to offer clients a broader perspective on their healthcare options. He specializes in helping individuals navigate the complexities of Medicare, providing unbiased advice tailored to their specific needs. His agency assists individuals in applying for original Medicare through Social Security and supports those seeking to qualify for Medicaid health benefits. Kareem's presentation will focus on the topics surrounding Medicare, and then I will present on the topics surrounding Medicaid Long Term Care. Kareem and I have known each other for quite some time now. We both frequent the plantation events and local networking events, and he's a colleague and a good friend, and I'm happy to have him here today presenting. And so, Kareem, please take it away.
Well, thank you, Bobby. Such a kind introduction. I really appreciate that. So as Bobby mentioned, my name is Kareem Grant. Today's presentation will be geared around original Medicare and some of the different options that you have available to you when you're on original Medicare. As Bobby mentioned, the annual election period is coming up. So right now we're currently in what's called the pre-AEP, which starts October 1st to October 15th. And then the AEP starts October 15th and ends December 7th. All right, so as Bobby mentioned, my name is Kareem Grant. I am an independent licensed broker here in the South Florida market. Normally what me and my team specialize in, we help individuals apply for their original Medicare Part A and Part B, and also help them apply for Medicaid if they meet the requirements to apply for Medicaid. So some of the things that we do help with as well is understand what's your deductible, kind of avoiding getting spam calls, being your go-to agency for all your questions, what to do when you're on original Medicare, and what are some of the options you have available to you. Which doctor can I go to, right? So whether you choose an HMO or PPO, we can help dissect that for you guys. How to get Medicaid, what are the qualifications to qualify for Medicaid? and also all my medications covered. So understanding those fundamentals is something that my team and I do on a daily basis. So who do we help? We do assist clients with different types of scenarios. So again, if you're turning 65 and aging into Medicare, this is your time to apply for Medicare Part A and Part B if you choose to do so. Older than 65 and losing insurance. So meaning some of my clients that turn 65, but they're still working and they decided to delay their Part B, you do have that option to do so without getting any penalty, which is totally fine. But as we go on and compare that group coverage compared to Medicare, sometimes clients decide to go towards original Medicare and choose a health plan that's going to reduce their cost. Unsure whether to stay on employer insurance or enroll in Medicare. Again, this is something that my team and I do. We do that comparison to see what's going to make more sense for you going forward. Unhappy with their current coverage. A lot of times these plans may change on the beginning of the year, starting January 1st. So my team and I would do that research, do that needs analysis and benefit review, just to see what plan is going to make sense going forward in the new year. And again, if someone is on Social Security disability, under 65, you can qualify for Medicare due to disability. If you're on Social Security disability for more than 24 consecutive months, those individuals will automatically qualify for Medicare Part A and Part B. So understand the A, B, C's, and D's of Medicare. So let's kind of understand what is Medicare. So Medicare is the U.S. government largest health insurance program serving more than 62 million people. Medicare is a federal health insurance program. It's designed for U.S. citizens and legal residents, and also it's individual health insurance. One of the common mistakes that some of my clients tend to always ask is, can I add my wife to my HMO or Marquis PPO policy? You cannot do that. Unfortunately, Medicare is always going to be individual. Each qualifying beneficiary must have both Medicare A and B and obtain their separate policy. Understanding what Medicare is not. So Medicare is not Medicaid. A lot of people kind of tend to confuse the two. Think of Medicare as federal and Medicaid as state regulated. Aid meaning you qualify for extra assistance due to low income. Medicare is not Social Security, and Medicare is not a family plan. Again, when you're on Medicare, it's always going to be individual. Who can get Medicare? So to qualify for Medicaid, you meet one of the following requirements. Within 3 months of turning 65 or older, or even if you're still working. Younger than 65, as I mentioned, with a qualifying disability. So again, if you're on disability income for more than 24 consecutive months, you can qualify for original Medicare. And also have end-stage renal disease, which is permanent kidney failure, needing dialysis. For those individuals that meet that qualification, you will automatically qualify for Medicare, and that leads you to choose a health plan with no underwriting questions, guaranteed issue policies. What does original Medicare cover? So breaking down original Medicare Part A. So normally Part A, that covers your hospital insurance. When you just have original Medicare Part A, that covers your hospital room and meals, intensive care, skilled nursing facility care, operating room and services, hospice care, rehabilitation services, some home health care as well, and also some of the medications that fall underneath Part A within the inpatient state hospitals. Part B, that covers medical insurance. So that'll be doctor visits, your annual wellness visits and preventive services, outpatient care, mental health services, clinical lab services, durable medical equipment, which are also known as DMEs, ambulance services, or occupational physical therapy. So when you break down original Medicare Part A, normally once you turn 65, you will automatically receive Part A at no charge. That's because individuals that qualify for Part A at no charge, they work more than 10 years here in the US, equivalent to 40 quarters. So everyone gets Part A for free. Part A does have a deductible. If you're going to be admitted into the hospital and you just have original Medicare, you do have to meet that hospital deductible, which is $1,632 per benefit period. If you stay in the hospital more than 60 days, you do have to start paying that copay again, which is $408. So again, most people are alarmed by these numbers. So that's why there's options that you can choose, whether that be a Medicare Advantage or what's called a Medicare Supplement Plan, known as a Medigap policy. Part B, that covers your medical insurance. Typically, everyone does have to pay a Part B premium, which is just automatically deducted from the Social Security check towards the federal government. That amount is $174.70 each month. The Part B does have a one-time deductible, which is $240. And then after you made that original deductible for the year, Medicare covers 80%. You do have to pay 20% out of pocket. Again, most people don't stay with original Medicare because it's more expensive when you just have straight Medicare. So Part B premium income bracket. Most people fall within the first bracket, which is at $174.70. That's if you filed an individual tax return less than $103,000 for the year. As your income increases or go up, your Part B premium can also be a little higher as well, as I show you on the right side here. So what does original Medicare don't cover? So original Medicare Part A and B does not cover all costs of your care on prior slides. It does not cover prescription drugs. That's for Part D, normally offered through a private insurance company. Your annual physical, dental, vision, and hearing benefits are also not covered by original Medicare. Those are covered by the additional policies that you can pick up. Hearing aids, eyeglasses or contacts, long-term care, and most care outside the US. So getting more from your coverage. So normally when you're on original Medicare, you have a few options that you can choose. You can either go with, as the first column indicates, a Medicare Supplement Plan, or also known as a Medigap plan. You can also go with a Medicare Advantage. Those are called your Part C, all-in-one plan. And also, those plans also cover additional benefits like dental, vision, hearing services, and other awesome benefits as well. So just to kind of give you a brief overview of Medicare supplement plans, the more common Med subs are Plan F, Plan G, and Plan N. These policies typically help cover what original Medicare does not cover, such as the 20% or that Part A hospital admission deductible. Typically, when you choose a Medicare supplement plan within your first 6 months of turning 65 or attaining your Part B, you go through what's called your guaranteed issue, which means the insurance company cannot ask any underwriting questions. That policy will be automatically approved. So when it comes to Medicare supplement plans, they are not regulated by the federal government like Medicare Advantage are, but it's regulated by the private insurance company, which means they can ask healthcare questions, and based on your condition or medication you're taking, they can deny enrollment into the Medicare supplement plan. But again, if you're within your first 6 months of your IEP or turning 65, you're in what's called your guaranteed issue. So this kind of break down the different Medicare supplement plans available. Again, you have your Plan G, Plan N, and Plan F are the more common ones. Just kind of give you a quick note, Plan F is no longer offered to new individuals that's just turning 65. But it is grandfathered in for some of the individuals that were 65 prior to 2020 of January 1st. They can still select a Medicare supplement Plan F. Kind of going over into Medicare Advantage, also known as Part C. So Medicare Advantage, the benefit of a Medicare Advantage plan, it covers benefits of Part A and Part B. You still have you're still on original Medicare, but now it's administered by the private insurance company, meaning the private insurance company becomes the primary provider. Whenever you see a doctor or a pharmacist or your dentist, you will hand them that Medicare Advantage card rather than handing them the original Medicare card. Again, additional benefits these plans cover is routine dental, routine eye exams and eyeglasses, our hearing tests and hearing aids, and also your wellness programs as well. Typically, when you choose a Medicare Advantage plan, those plans will have a 0 monthly premium. In addition, you do have to continue to pay that Part B premium towards the federal government. Again, that'll just be automatically deducted from the Social Security check. It does cover most of the Medicare Advantage plan will also cover your Part D for your medications. Other factors to consider when choosing a Medicare Advantage policy, whether that be an HMO or PPO. If it is an HMO, you may need referrals to see a specialist, and also coordinated care support with provider network, meaning you have to stay within a network of that insurance company that you choose. So the reason why you have to get referrals with some plans is when you consider the care model of that referral, it's a way for the doctors to communicate and be on the same page. So that referral is a way for your PCP to understand what's going on when you see that specialist, whether it be a cardiologist or an endocrinologist. It's very important that your primary care doctor is aware of what's going on. Part D, again, this is for your medications. Part D does cover some of the most common medications, specific brand names, generic drugs according to the plan's formulated drug list, and vaccines not covered by Part B. That's typically covered underneath your Part D medication. Again, when you choose a Medicare Advantage plan, it does include Part D, it's already built into that policy. If you choose a Medicare supplement plan, then you do have to pick up a standalone Part D plan to go along with it. These are some of the breakdowns of the Part D. Typically, Part D does not have a premium that you have to pay towards the federal government. You just have to pay the plan's premium for that particular policy. If your income is a little bit higher, you do have to pay an extra tax towards the federal government. As that illustration shows you here, it's $12.90 if your income as an individual is between $103,000 up to $129,000 for the year. The way the Part D is staged for the current year, and we are expecting some changes for 2025 when it comes to this portion, but as of this year, Part D is divided into 4 different stages. Your annual deductible stage, your initial coverage period, the coverage gap, and the catastrophic coverage. So typically, if you choose a standalone Part D plan or a policy like a Medicare Advantage plan, those plans may have deductibles that you have to meet prior to that medication being covered. So that's stage 1. Once you meet that deductible, then you move over to stage 2. That's called the initial coverage period. This is when the insurance company helps cover the cost of your medications. Most generic medications are zero, which falls under tier 1 and tier 2 drugs. Those would be a zero copay. And then in order to fall into stage 3, which is the coverage gap, once the total cost of what you pay an insurance company covers adds up to that $5,030, that's when you can fall into the coverage gap known as a donut hole. At this point, the insurance company no longer helps cover that medication, but you still get discounts through the manufacturer. So making a decision, what should you choose, option 1 or option 2? That's something my team and I kind of dissect and do our needs analysis to see what plan is going to make more sense for you going forward. What we take into consideration is how often you travel, your cost, that's going to be important to you, and whether your doctors are flexible or in the network with the insurance company. So those are some of the needs analysis that we do to compare different options on what's going to work best for you. What should you consider? What am I able to spend on premiums, deductibles, co-insurance, and copays? Does the plan I'm considering have all the benefits I'm looking for? And again, what's most important to you when it comes to choosing a health plan? Additional considerations, a special needs plan. So these are for individuals that have chronic conditions like diabetes or heart conditions, receive Medicaid assistance from the state, or live in a particular nursing home or facility. There are certain plans that qualify for those individuals that live in a particular nursing home. But again, when you do qualify for these special needs plan, you do get additional benefits when you have Medicaid. Financial assistance, so depending on your income and assets, you may qualify for additional assistance through Medicaid or the Medicare Savings Program to reduce Part A and Part B costs. And again, that's something that my team and I do. We do help our clients qualify for Medicaid based on their income qualifications. Enroll into Original Medicare. So again, when you're turning 65, you do have 3 months prior to start the process of enrolling to Medicare and reaching out to Social Security to kind of get the ball rolling. That's something that we help you with. And once you're in that window of IEP, you have 7 months to decide what plan is going to work best for you. So that's 3 months prior, the month of, and 3 months after. Again, enrolling to a Medicare supplement plan, you do have that no underwriting required, which is guaranteed issue. And that's within the 6 months of you turning 65 and enrolling into Part B. Working past 65, again, you can work past 65 and elect to delay your Part B, and you won't get penalized as long as that group coverage meets Medicare credible coverage requirement. There's no penalty for delaying your Part B. And again, this just breaks down the original Medicare and when to apply. And changing your plan. So right now we're coming up into the annual election period, which starts October 15th through December 7th. Around this time frame, you can kind of do your needs analysis, your benefit review with your agent, and go over some changes with your current plan and what's to expect in the new year. Around this time period, most people shop around and decide to change their policy if it behooves them to do so. If your current plan no longer meets your needs, this is your time to kind of shop around. You do have another window starting January 1st to March 31st. That's called the open enrollment period, where you do have another exception to change your policy. Outside of that window, you're normally locked into your plan unless you meet a special enrollment period, which kind of lists out here. So again, don't be late. Be sure if you're turning 65 and you don't have access to group or employer coverage, you want to enroll into Medicare Part A and Part B and Part D, because by delaying that, you can get penalized for not having Medicare Part B or Part D. But again, if you're still working and have access to employer coverage, you can delay Part B and Part D, as long as that employer coverage meets Medicare credible coverage. So these are some of the terminology just to understand benefit period and co-insurance and co-pays and deductibles. Again, if you guys have any questions, feel free to reach out to me directly. I will provide my contact information as well. And that is all, guys. If you have any questions, feel free to put in the chat. I would definitely monitor the chat and answer some questions for you guys within that chat.
Thank you, Kareem. That was great. That was a lot of information. I know that, some people need you could discuss this, the entire hour, I'm sure. We will be sending around a recording of this webinar so you can revisit any slides, any issues through the recording. And you can, of course, reach out to Kareem individually with any questions, and you can ask questions at the end of our program. And so we will put this slide up again at the end with our contact information. I am going to go through the next phase of our program, which is about the Medicaid Long Term Care benefit. And that is starting now. Okay, so as Kareem mentioned, Medicare covers some short-term rehabilitation after a setback. And the way that works is if you have Medicare coverage and you have a significant health issue that requires rehabilitation, such as you've fallen and break a hip, or you've got a stroke or some kind of major health setback. For the first 20 days, Medicare covers 100% of rehabilitation. For days 21 through 100, 80% is covered. And for after, as of day 101, coverage ends. Now it's not considered short-term rehabilitation. Now it's out of Medicare's purview. Now it's considered long-term care. It's very expensive. So how do you pay for that? Because Medicare does not cover long-term care. And when we talk about long-term care, it can be one of three things. It can be a home health aide that visits you in your own home for a certain specified number of hours per week. It can be you moving into an assisted living community, which offers more supervision and support. And it could be a skilled nursing facility, which is also called a nursing home. That's more like a hospital setting and for people who are very sick. And so it's very expensive. You know, how much does long-term care cost? Genworth does a survey every 2 years or so by region and discusses what some of your long-term care costs are. So for 2023, these are some of the averages. You know, you're looking at, for home health care, you're looking at $5,700 a month. For assisted living, around the same, $5,200 a month. Nursing homes, astronomical, you know, some from 10 to 14,000, depending on if it's a shared or semi-private or private room. And so the costs are very high. And so you should have some kind of a plan in place as to how you're going to pay for that. Your options are, if you have long-term care insurance, that's excellent. Not many people do, because even that's a little bit pricey. But if you have long-term care insurance, it will help cover some of this cost. If you're still, if you're still in a window where you can purchase long-term care insurance, you may want to consider that now. And I would say that's in the before age 70, because, if you begin to have diagnoses and health issues, there are underwriting, there's underwriting involved with long-term care insurance, and you may not get approved. So it's better to do that earlier. If you can afford that, it's a great coverage to have. You can private pay. You know, you can use your savings and pay, write a check every month and pay for your long-term care. If you have substantial savings, that will work. Most families cannot sustain that kind of cost for a long period of time. So the third option, and the option that we specialize in it here at Miloro Law, is Medicaid Long Term Care benefits. And it's a benefit provided by the government. It's federal funds, but each state operates it individually. And it can help cover some of your long-term care costs. So an elder law attorney helps seniors save thousands in long-term care costs by qualifying for this Medicaid long-term care program, and helps seniors name trusted decision makers. In case of an emergency, someone has to have your written permission to make financial and medical decisions for you. So that's all very important to have in place as well. And when we talk about the Medicaid program, it picks up where Medicare leaves off. It helps to pay for long-term care. The average savings, either at home or in an assisted living community through this program, are upwards of $24,000 per year. And the average savings in a nursing home or skilled nursing facility are upwards of $95,000 per year. So it's a very valuable benefit, and great to have. It's also very hard to get, and that's why attorneys are often needed. There are two types of Medicaid. One is the called ICP, and that's for people in a nursing home, covers nursing home expenses. The other program is called HCBS, which stands for Home and Community-Based Services, and that covers your home health aide or assisted living community. So those two programs, the eligibility criteria is the same, but the benefit is a little bit different. In a nursing home, the ICP Medicaid pays the full bill minus your patient responsibility amount, which is like a copay, and it's based on your income. So if your Social Security is $2,000 per month, that is what you would owe to the nursing home, and the Medicaid benefit would cover the rest. So that $14,000 nursing home is now costing you $2,000. So it's a huge benefit. It does not replace your health insurance. You will still have Medicare health insurance. It covers long-term care facility type costs. The other program for the HCBS, for home care or assisted living, there is a wait list involved. It takes, when you're working with an attorney, we can help expedite that as much as possible. Many people get on the wait list and sit on there forever, sit on there for months, years. If you work with an attorney, you can try to expedite that process. Our clients average about 3 to 4 months on the wait list. We help you through that whole process. We counsel you, how to answer the questions and get through the wait list as really advocate for yourself. So it's important. The reason I point out the wait list is you don't want to wait until the last minute and you're in dire need of care, because it can take some time to get those benefits in place. So it's better to start earlier rather than later. It pays a portion of your home care or assisted living. In the home care setting, they would assess you, determine how many hours of care you need per week, and they would pay for the cost of that approved number of hours. So maybe you would get 20 hours per week of a home health aide free of charge in that example. And in an assisted living community, it pays a portion of your assisted living fee. So if a community costs, and the average is $1,800 to $1,900 per month for that benefit. So if a community costs, as an example, $3,800 per month and Medicaid covers $1,800 per month, you owe $2,000 per month. So it's very valuable regardless of where you are at home, assisted living, or in a nursing home. The eligibility test is 65 and over. And you have to need assistance with activities of daily living, and you have to qualify financially as well. It's based on financial need. They look at income, they look at assets. So for the assistance with activities of daily living, there are several of those. If you need help feeding yourself, and that doesn't just mean, chewing and swallowing, it means shopping for groceries, preparing food, cooking, things like that. Bathing, if you are unsteady on your feet, you need help taking a shower, getting dressed, going to the bathroom, some continence issues. Mobility, if you use a walker, a cane, again, unsteady on your feet. Transferring means getting up and down from a chair or in and out of bed. So those are the types of assistance. If you need those types of assistance, the Medicaid program, the long-term care program, can be a big help. The financial eligibility requirements for income. This goes up each year. There's a cost of living adjustment because your Social Security goes up each year. Right now, the income cap is $2,829 per month. If you're over that, if you make more than that, there are solutions and you can still qualify. You would need the assistance of an attorney who can help you qualify. If you're under $2,829 per month, you qualify from an income perspective. The asset cap is really what discourages most people from applying for this benefit, because the countable assets, it hasn't gone up since I've been practicing in this area. It's been $2,000 the whole time, and that's in countable assets. Again, there's a solution. If you're over $2,000 in countable assets, an attorney can help you qualify for the program. Elder law attorneys know the Medicaid rules, and they know what's allowed and what's not allowed from an income and asset perspective. Some assets are not counted by Medicaid. Your homestead is not counted. Many people are confused about this. You are allowed to have a homestead. It's not a countable asset for Medicaid purposes. You're allowed to have a car. Certain prepaid funeral plans are not counted. Certain life insurance are not counted. And IRA and retirement accounts are not counted. The principal is not counted so long as you're taking regular distributions, and those distributions count toward your income instead. There are sheltering strategies. When I say there's a solution, an attorney can work with you to help you qualify in compliance with the Medicaid rules. If you have a spouse, there are certain strategies we can employ by transferring assets to your spouse's name. If your spouse does not need Medicaid, only one spouse does. There's something called a personal services contract, which is a written document that allows you to pay one of your adult children for the help that they're providing for you. There's a special needs trust option. There's income producing property. You could rent out your home and shelter it that way. You can hold real estate jointly with another person, and you can use something called a qualified income trust if your income is over $2,829. So these are, some complicated strategies and issues, and we can go through them in more detail depending on your individual circumstances. But that's just an overview of some of the things we can do to help people qualify for Medicaid if they have their income or their assets are too high. Oh, one tip today, please take this tip home with you. Protect your home with the Ladybird deed. It's allowed by Medicaid. It's something everybody should have. If you own real estate, if you own it in your own individual name and you pass away, that real estate's going through probate, regardless of whether you have a will, regardless of whether you have a trust. What governs real estate is the deed. So the deed has to be worded in the right way to avoid probate. We can do this with a Ladybird deed. Medicaid allows it. You can name a beneficiary right there on your deed. You could name your trust as a beneficiary or family members. It's a great strategy. Highly recommend it. it's allowed by Medicaid, allows your real estate to pass automatically to either your trust or your loved ones without the need for probate. And as far as incapacity planning, we talk about, two very important documents that every adult needs, especially senior adults, is healthcare advance directives and durable power of attorney. That gives your written permission to a loved one, a trusted individual, to make medical and financial decisions for you in the case of an emergency, in the case you can't do it yourself. The most important document that we use to qualify clients for Medicaid long-term care benefits is a durable power of attorney. I highly recommend that you have one in place if you don't yet. And again, here's our contact information. And we will open, oops, let me get that. I'm going to keep this up while we open the floor for questions. So if anybody has questions, please, Denise will kind of read those for the group and we will answer them to the best of our ability. And if for any reason we don't get to your question or don't have time to address it, feel free to reach out to us individually.
Don't be shy. You can type your question in the chat, either for Kareem or for Bobby. So on Medicare or Medicaid long-term care planning. And if we don't see any questions, I believe we have some frequently asked questions that we can go through.
I have a couple of questions for Kareem, if you don't mind. I know that we went through those Medicare parameters. So
Sure.
what is the difference between, you mentioned there's an annual enrollment period that starts in October, and then there's an open enrollment period that starts in January. Does that differ for various people, or how do you know what period you should be looking at?
Yeah, great question, Bobby. So the annual election period is a standard Medicare annual election period each year where folks, whether they're on straight Medicare or they're currently on a Medicare Advantage plan or on a Medicare Supplement plan, this is their window to shop around and change their policy effective for January 1st. So that's called the AEP. Everyone is entitled to it as long as you're 65 and have Medicare A, or whether you just have A and B or just Part A. The OEP, which starts January 1st to March 31st, this is a fairly new window. It started maybe about 3 years ago. It's for individuals that's currently on a Medicare Advantage plan. So let's say during the annual election period, you decided to enroll into a new policy. That policy became effective January 1st. You try it out for a few months, the first 2 months, it's not working out for you. Medicare will allow you to change out of that policy. If you somehow missed the window of AEP and you just didn't make a change and you still want to make a change to your Medicare Advantage Part C plan, that allows you to make a change as well. For the individuals that have just straight Medicare and maybe they have a Medicare Supplement plan and a standalone PDP, those individuals cannot make a change during that OEP window, again, from January 1st to March 31st. So that's the main difference. Again, everyone that's entitled to Medicaid can make a change during the AEP, October 15th through December 7th. The OEP, the one exception that individuals cannot make a change if they have straight Medicare. They can't choose a Medicare Advantage plan in that window. It's not.
But they can in October.
They can in October. Right.
Got it.
Right.
Okay,
So I'll just. No, go ahead.
I'm sorry. There's a few questions coming in from the chat. Bobby, for you, can you get a ladybird deed even if the home is still being paid for?
Yes, absolutely. This is why, and this is the beauty of it. It doesn't change ownership now. You still keep your homestead, you still keep your tax exemption, you still keep the mortgage. Nothing changes at all with respect to your ownership while you're still living. Nothing happens until you pass away, and it just allows the title to pass to somebody else. But yes, you absolutely can do that. And you don't even have to notify your mortgage company because, again, nothing's changing with the ownership now until you die. So yes, you can.
And Kareem, we have a question for you. Are you familiar with Humana Gold Plus cardiac and diabetes plans? And if so, what are your thoughts? both pros and cons?
Mhm. That's a great question. Yeah, that's Humana's C-SNP plan here in Broward County. Um, it's good in a sense because it does give you some additional benefits like a Part B reduction where you get back $150 towards your Part B premium. And you do get a slight healthy food allowance in the amount of to help you buy groceries. But it does have its pros and cons when you do your comparison to the Humana Core HMO plan. That policy will have lower out-of-pocket expenses and lower copays versus the chronic C-SNP plan. The chronic C-SNP plan, you may have a specialist copay or a hospital admission copay. So that's when you want to do your comparison and see, what's going to make sense for you and what's most important to you in the current moment, what's going to cover your needs. So whether you want the additional benefits, the Part B premium reduction, or you just looking to minimize your out-of-pocket expenses, typically most folks tend to lean towards the core HMO, which is the Humana Gold.
Bobby, and another question for you. Mother-in-law needs Medicaid, where to apply?
So it depends on the type. If it's home care or assisted living, that's the HCBS program. You first have to go through the wait list for that. You're not even allowed to apply for Medicaid until you've been approved through the wait list process. If it's for nursing home, somebody can apply as soon as they're admitted to a nursing home without having to go through a wait list. And it's the application is submitted through the Department of Children and Families. We assist with that. It can be a cumbersome process, but you can't submit your application to DCF for home care or assisted living until you first go through a wait list with a different agency. You actually work with 3 agencies to get the Medicaid Long Term Care program. One is your wait list agency. Every county has its own. The other is the Department of Children and Families, and the third is the Department of Elder Affairs. They come and do a physical assessment to assess your needs.
Okay, Kareem, is there a plan, either a plan or supplement or advantage that covers dialysis patients?
Yeah, great question. So yeah, there are plans that cover dialysis. You just have to have Medicare Part A and Part B. If you choose a Medicare Advantage plan like an HMO, you do just have to get that authorization, and it's typically authorized and covered. The good thing about having a Medicare Advantage plan, those plans have what's called a maximum out-of-pocket expense. So for example, Humana has a policy where if you're on dialysis, you do pay 20% coinsurance, but that adds up to $1,000. Once you hit that cap, you're covered at 100% for the rest of the year. Of course, if you meet Medicaid qualification and your income is below a certain threshold, and you apply for Medicaid and get approved, then you choose a policy where it's called a D-SNP plan, and that dialysis would be zero all across the board all year round. Medicare supplement plans also cover dialysis. You just want to be sure you choose a Medicare supplement plan when you're in that 6-month window, because again, that's your guaranteed issue. Unfortunately, outside of that window, if you try to apply for Medicare supplement plan and currently on dialysis, the insurance company is not going to approve that application, unfortunately. Hope that answered your question.
Okay, if you have further questions, feel free to type them in the chat. Happy to answer some more questions if you have them.
I wanted to kind of make an observation about I know that there's Medicare Advantage plans, which are like an HMO, which are much more affordable than traditional Medicare because they have, the lower, you're not dealing with so many copays and deductibles, and your insurance costs overall are lower. The drawback to those is you have to stay in network. It's an HMO. Not every facility accepts those. Not every doctor accepts those. I just had an experience with my own mom that I would like to share. And if you ever are needing rehabilitation, right? That's where it really became an issue for my mom. She was on the Medicare Advantage plan. She broke her hip. She needed rehabilitation. We were very, very limited as to where she could go for her rehabilitation because the rehabilitation facilities only accept certain plans. Their doctors, their diagnostics all only accept certain plans. So they won't even let you rehabilitate there if you don't have the right insurance. So that's one of the big drawbacks of the Medicare HMO plans. The big advantage is the cost, obviously. And then just one other observation about how Medicaid and Medicare kind of work together. Traditional Medicare Part B, as Kareem mentioned, costs $174.70 per month. That's for 2024. It automatically gets deducted from your Social Security. If you qualify for this Medicaid Long Term Care program, if you need assistance with your activities of daily living and we get you on this Medicaid Long Term Care, that Medicare Part B is free. That $174.70 a month goes away. You no longer have to pay it, so you get a little raise. You also get, Kareem mentioned, Medicare does not cover vision and dental. The Medicaid Long Term Care program does. So you get free vision and free dental and lower cost prescription drugs. So most people, when they need assistance with activities of daily living and they qualify for this Medicaid Long Term Care program, they save significantly on health insurance too, and they no longer need a supplemental plan because Medicaid is kind of like their supplement. It covers, all of the things that a supplement would. So there are additional health benefits to that as well.
Okay, I'm not seeing any more questions in the chat. Anything you'd like to add, Kareem or Bobby?
Nope, very good. Bobby nailed it there, the last bit of information. But yeah, feel free if you guys have any questions you want to take offsite, feel free to reach out to me via my email or give me a call or even shoot me a text. More than happy to have a one-on-one meeting with anyone that has questions or need to review their current plan benefit. Just be on the lookout if you are currently on Medicare and have a Medicare Advantage plan. Be on the lookout what's called your ANOC. That's your annual notice of change. It normally goes out end of September, beginning of October, where you're just going to highlight your current policy and any changes going into the new year. So be on the lookout for that. Also, if you're currently on a Medicare Advantage plan, be sure to review the formulary because there may be some changes when it comes to the formulary for 2025, just due to some Medicare rules and regulation updates with the Part D Inflation Reduction Act. So just be sure during this AEP, you're really checking out your current plan, whether your provider is dropping your current policy. Be sure to kind of do that research and get in touch with your agent. And if you don't have an agent, feel free to reach out to me or anyone on my team. I can, we have bilingual speaking agents as well. So if you do need assistance during this time period, feel free to reach out to us anytime.
Kareem, is there any kind of resource that kind of shows what the different plans cover? I've seen these different charts where they'll put a check mark, as to what's covered under a specific plan. Is there something that can help people pick a plan, or is it really best to sit with an agent and go through all of your needs?
It's really good to sit with an agent just to go through your needs, but it can be so overwhelming. But if you do want to do your own research, the best resource is going to be Medicare.gov. So Medicare.gov actually compares all the plans within your market, and you can kind of choose three, as Bobby said. It has the check marks. You add your medication and see what plan is going to cover your medication best. So if you do want to use an online tool, the safest tool, the most unbiased tool, of course, is going to be the federal government's website, which is Medicare.gov.
Perfect. All right. Well, thank you all very much for joining us today. We will circulate a recording of this webinar in case you want to revisit any issues or go back and look at any slides or slow things down a little bit. And of course, feel free to reach out to any of us with any specific individual questions you might have. And have a great day, everybody. We are ending the program.
Thank you. Have a good day.